Good day, my wonderful people. My name na Dr.Observer. Now maybe that una doctor wey dey observe, analyze, and bring solution to different medical problems. So, like today, the challenge wey we dey get now na on glaucoma. Many people don dey wonder wetin be glaucoma, wetin be glaucoma. It's a confusing question. At the same time, very scary. Glaucoma na im be that disease wey dey blind people eyes. For Igbo land, they call am isi anya eke. A person's eyes will be open without any underlying pathology. But inside the eyes, destruction is going on. Now glaucoma be that disease wey be say you go see person, the eye go open, no abnormality. But when you look inside the eyes, you go see say the person don dey go blind because say e get one wire wey dey connect the eye to the brain, wey dem dey call optic nerve. Now the optic nerve na be the connecting wire between the eye and the brain, because we look with our eyes but we see with our brain. Your vision is interpreted in the Broadman area. We call it the area 17, 18, 19. These are the areas of interpretations of visions. So wetin be this glaucoma? During my practice, in Delta State Hospital, Old Central Hospital, Delta State, I have so many patients who rush to the clinic like with the aim that say person don't blind me. That my neighbor will tell me say him go blind me. The thing will come make me laugh. I can't say, mama, make you calm down now, make you check wetin dey happen. On observation, during the examination, I can't discover say na glaucoma. Na in the blind this woman, and she no know. The time when she take come clinic, the glaucoma have almost finished her eyes. It is at late stage of glaucoma, which is the CD cup ratio is about 0.8. The doctor no go fit do any magic because doctors are not magicians. By the time when the woman will carry and come clinic, come say glaucoma don damage the eyes, pata. We will come dey say na family people, say na my uncle, say na my neighbor. Say that woman will tell me say she go show me shege. Say she don't finally do me wetin she tell me say she go do me. Mama, no be like that. It's very, very funny. But na glaucoma na im dey cause am, because glaucoma no dey show any sign. Na something wey be say you go just come gba, you don't chop the eye, because it's an ongoing destruction of the optic nerve. If you look at my screen here, you will see the optic nerve of a normal eye wey no get glaucoma and optic nerve of a patient with glaucoma. You go see say for the one wey dey normal, there is no destruction of the optic nerve. Let me stand up and point it for you. Look at the optic nerve during the ophthalmoscopy examination of a normal person without glaucoma. You go see say the blood vessels, everything dey intact, even the optic nerve, the neuroretinal rim, everything is intact. Then look at the optic disc of a patient with glaucoma. You go see say here we be say it don white. This is where the optic nerve is located, because now the optic nerve now they carry information from the eye to the brain. Now their vision they interpreted. But if you look at now, you see say destruction don already happen for the optic nerve. So this eye is now gone. If you check the visual acuity or the visual field, the eyes they don't blind from glaucoma. There are basically three types of glaucoma. We have the primary open angle glaucoma, we have the closed angle glaucoma, we have the normal tension glaucoma. The one that is called the silent thief of sight is the primary open angle glaucoma, because the primary open angle glaucoma doesn't give you any sign. It will just come and steal the sight because it's a progressive destruction. Most people that have primary open angle glaucoma, they don't even know they have anything called glaucoma until about after 10 years. And you can imagine the duration. By such time, the eye, the optic nerve, don't be damaged, because glaucoma is a pressure disease. In primary open angle glaucoma, the intraocular pressure is raised. If they do tonometry, if patients come to the clinic and they do tonometry, the intraocular pressure is high, because as the pressure they increase, now so damage they happen for the optic nerve. The reason why the primary open angle glaucoma is called a silent thief of sight, because it doesn't give any sign, no headache, no pain, but there is an ongoing destruction. During my NYC in Delta State again, a boy walked into the clinic with his dad. We argued. The child was telling me that the father's eyes is very okay. That is not seeing any pathology or abnormality in the eyes. I told the young man that that glaucoma is an internal eye disease. That is not what he can see. See, glaucoma is a disease where they happen for inside the eye. No be waiting you go just see physically. You go see some persons, you go come the one that say, this person eye do okay, now he's looking healthy. This person still get glaucoma. I go say yes, because it's not what you see from the external eye. In fact, you are just looking with your eyes. What you see is with your brain. So primary open angle glaucoma is a silent thief of sight, because it doesn't give you any pain. Suddenly the person is blind. and we'll come to say now witches and wizard. That one they apart. Then let's talk about the closed-hand glaucoma. The closed-hand glaucoma, that word close means that the anterior chamber is closed. You get one chamber wey dey for the eyes, wey they call the anterior chamber angle. That is through the angle through which the aqueous humor leaves the eyes. So once that chamber is closed, the pressure will rise. But this one is a better one version of glaucoma because it will give you severe pain and headache and congestion. If you look at the eyes, it's always red and it is mostly unilateral, meaning say they affect only one eye. But primary open-hand glaucoma, both eyes they affect. Then the third glaucoma, and they call the normal tension glaucoma. This one is silent devil too because the pressure is not increased, but there is an ongoing destruction behind the eyes. Now they say, Mama, Papa, please hurry up to the clinic and check your eyes. Don't wait for what glaucoma did before you begin to check your eyes. Prevention is better than cure. The aim of this program is to give you preventive measure so that you can prevent the blindness that is caused by glaucoma. Glaucoma is silent thief of sight. If you leave your eye for glaucoma, glaucoma go chop am. And that's one your own cup of tea. You know go say you know hear am. That is why me, Dr. Observer, is here to break it down for you. The normal tension glaucoma, the patient is brought to the clinic and we check the pressure. But in this case, the pressure is within the normal limit, and the normal range of pressure for the eyes is 16 to 21 millimeter of mercury. Now, in that one, you can't wonder, okay, this person's pressure is okay. Then what is now the cause of his blindness? That is when we now go to the next test called ophthalmoscopy. In ophthalmoscopy, let us go to the screen so that you will see the picture of ophthalmoscopy where a doctor is carrying out ophthalmoscopy on patients. Okay, look at the screen. You will see the images of a doctor examining a patient with his ophthalmoscope. Now, this ophthalmoscope, they check inside the eyes to rule out glaucoma. You can see the doctor holding an ophthalmoscope, examining the eyes of a patient. Now, this instrument, the doctor will take scope the eye to look back of the eye where that disease they happen, that glaucoma disease. So this is examination. Now, the doctor will take rule out whether this eye is healthy or not healthy. In this examination, that former picture when I show now, where you see the eyes of a person with glaucoma, if you do the examination, the doctor uses this equipment to rule out if you have optic disc cupping or you don't have optic disc cupping. The third test is tonometry. Let us also check tonometry. Tonometry is the process through which the doctor measures the eye pressure. Now, the doctor measure the pressure within inside the eyes.